Basic social casework concepts. Social casework. Meaning of social casework. Social casework is a method of social work that focuses on helping individuals solve their problems and improve their social functioning through a one-on-one relationship between the caseworker and the client. It is a process that helps people cope with their difficulties by addressing personal, social, and environmental factors. Definitions of social casework. Mary Richmond, 1917, social casework is the art of bringing about better adjustments in the social relationship of individual men or women or children. Perlman, 1957, social casework is a process used by certain human welfare agencies to help individuals cope more effectively with their problems in social functioning. Hamilton, 1951, social casework is an individualized service of adjustment and development. Objectives of social casework. To help individuals achieve better social functioning. To assist in problem-solving and coping mechanisms. To enable individuals to utilize available resources. To develop the personality and self-sufficiency of individuals. To promote social justice and human dignity. Characteristics of social casework. Individualized approach. Every case is unique and requires personalized intervention. Client-centered, focuses on the needs and capabilities of the client. Problem-solving process, aims to resolve social and emotional difficulties. Use of professional relationship, establishes trust and rapport between the caseworker and the client. Focus on social functioning, enhances the client's ability to interact effectively within society. Principles of social casework. Social casework is based on fundamental principles that guide the caseworker in effectively helping individuals. These principles ensure that interventions are professional, ethical, and client-centered. 1. Principle of acceptance. Every individual is unique and must be accepted with dignity and respect, regardless of their background, problems, or behavior. The caseworker must create a non-judgmental environment where the client feels safe and valued. 2. Principle of individualization. Each client is treated as a unique individual with specific needs, strengths, and challenges. Solutions should be tailored to the particular circumstances of the client rather than applying generalized approaches. 3. Principle of self-determination. Clients have the right to make their own choices and decisions regarding their lives. The caseworker should provide guidance but not impose their own views or decisions on the client. 4. Principle of confidentiality. Personal information shared by the client must be kept private and only disclosed with their consent or when legally required. Confidentiality helps build trust between the caseworker and the client. 5. Principle of controlled emotional involvement. The caseworker must show empathy and understanding without becoming emotionally overwhelmed. Maintaining professional boundaries ensures objective decision-making and prevents emotional burnout. 6. Principle of client participation. The client should actively participate in identifying problems, setting goals, and developing solutions. This empowers the client and makes interventions more effective. 7. Principle of use of resources. The caseworker should help the client access available community resources, such as healthcare, education, employment services, and social welfare programs. Utilizing external support systems enhances the client's ability to cope with their problems. 8. Principle of purposeful expression of feelings. Clients should be encouraged to express their thoughts and emotions freely. The caseworker listens attentively and helps the client process their feelings constructively. 9. Principle of relationship. A professional relationship between the caseworker and the client is essential for successful intervention. Trust, empathy, and communication form the foundation of this relationship. 10. Principle of social functioning. The ultimate goal of social casework is to improve the client's ability to function effectively in their social environment. The caseworker helps the client develop skills, adapt to changes, and resolve conflicts. Components of social casework. 1. The person, client. The individual who is experiencing difficulties and seeks help from the social caseworker. Clients may have personal, social, emotional, or environmental challenges affecting their well-being. They could be individuals, families, or groups in distress due to issues like poverty, family conflicts, health concerns, mental health struggles, or social maladjustment. 2. The problem. The issue or difficulty that the client is facing, which disrupts their social functioning. Problems may be categorized into personal problems, psychological, emotional, or physical health issues. Interpersonal problems, relationship conflicts within family, friends, or workplace. Environmental problems, economic hardships, lack of social support, discrimination, or inadequate access to resources. 3. The place, agency/institution. The organization or institution where social casework services are provided. This could be a government agency, NGO, hospital, school, correctional facility, or private practice. The agency provides resources, policies, and guidelines for delivering social services. 4. The process, casework process. The step-by-step method used to help the client through professional intervention. The process generally includes study, understanding the client's situation through data collection, interviews, and observations. Diagnosis, analyzing the client's problem and identifying its causes. Treatment/intervention, developing and implementing a plan to help the client resolve their issue. Evaluation, assessing the effectiveness of the intervention. Termination, ending the case when the client has achieved their goals or is able to function independently. Follow-up, monitoring the client's progress after case closure to ensure stability. Important social casework concepts, social roles. 1. Social roles in schools, school social work. Counselor, helps students manage emotional, behavioral, and academic challenges. Mediator, resolves conflicts between students, teachers, and parents. Advocate, supports students with disabilities, special needs, or those facing discrimination. Resource connector, links students and families to mental health services, financial aid, and community resources. Crisis interventionist, provides immediate support during school crises, e.g., bullying, abuse, trauma. 2. Social roles in clinical settings, clinical social work. Therapist, provides individual, group, or family therapy for emotional and psychological issues. Case manager, coordinates healthcare, counseling, and social services for patients. Advocate, ensures patients receive proper medical care, mental health support, and social benefits. Educator, helps clients understand their mental health conditions and coping strategies. Support system builder, works with families and caregivers to create a supportive environment for patients. 3. Social roles in administration and management. Policy developer, designs and implements policies that improve social welfare services. Supervisor, oversees caseworkers and ensures ethical, effective service delivery. Program coordinator, develops and manages social service programs for communities. Budget manager, allocates resources efficiently to fund social work programs. Trainer and educator, provides professional training for social workers and staff. 4. Social roles with children and families, child welfare and family social work. Child protection officer, identifies and prevents child abuse, neglect, and exploitation. Family counselor, supports families dealing with divorce, domestic violence, or parenting issues. Foster care coordinator, places children in safe, supportive foster homes. Adoption specialist, assists in legal and emotional aspects of adoption. Parental educator, guides parents on effective parenting strategies and child development. 5. Social roles in forensic settings, forensic social work. Court advocate, supports individuals involved in legal cases, victims, offenders, juveniles. Probation/parole officer, assists individuals reintegrating into society after incarceration. Victim support worker, provides emotional and legal support for crime victims. Correctional counselor, offers rehabilitation programs for prisoners. Expert witness, provides professional insights in legal cases related to social issues. 6. Social roles in occupational settings, occupational social work/industrial social work. Employee counselor, addresses workplace stress, substance abuse, and conflicts. HR consultant, helps organizations create inclusive, employee-friendly policies. Workplace safety advocate, ensures employee well-being in hazardous job environments. Career advisor, guides employees on career growth and professional challenges. Mediator, resolves disputes between employees and management. Social functioning and the role of social casework. Social functioning refers to an individual's ability to perform their social roles effectively within their environment. It includes interactions with family, work, community, and other social settings. When an individual faces difficulties due to personal, societal, or environmental factors, social casework plays a crucial role in restoring or enhancing their social functioning. Role of social casework in social functioning. Assessment of needs identifies the strengths, challenges, and social issues affecting an individual's functioning. Problem-solving approach helps individuals cope with personal and social problems through case-by-case intervention. Resource mobilization connects individuals with necessary resources like healthcare, financial aid, or counseling. Emotional support and counseling addresses emotional distress and strengthens coping mechanisms. Empowerment and self-development encourages individuals to develop skills and confidence to function independently. Advocacy and social justice works to remove systemic barriers affecting individuals' well-being. Crisis intervention provides immediate assistance in emergency situations like domestic violence, homelessness, or mental health crises. Need assessment and its significance. Need assessment is a critical process in social casework that helps identify the requirements and challenges of individuals, families, or communities. Significance of assessment. Informed decision-making ensures that interventions are tailored to the specific needs of the client. Client-centered approach focuses on the unique experiences and strengths of the client. Prioritization of issues helps in addressing the most urgent and significant problems first. Prevention of future issues identifies potential risks and mitigates them early. Efficient use of resources ensures that time, funds, and services are allocated effectively. Monitoring and evaluation helps in measuring the effectiveness of interventions and making necessary adjustments. Social adaptation. Social adaptation refers to the process by which individuals adjust to their social environment, norms, and expectations. It involves learning behaviors, attitudes, and skills necessary to function effectively in society. Social adaptation can be influenced by personal experiences, cultural background, and external social conditions. Social environment. The social environment consists of external factors that influence an individual's interactions, behavior, and development. It includes relationships, institutions, culture, and societal norms. Components of the social environment. Family, the primary unit of socialization, shaping values, beliefs, and behavior. peers and community, social groups that provide support, interaction, and influence. Educational institutions, schools and universities that play a role in knowledge development and social skill building. Economic conditions, employment, income, and financial stability affecting social participation. Political and legal systems, laws, policies, and governance shaping societal norms and individual rights. Cultural and religious influences, traditions, values, and moral guidelines that affect social behavior. Technology and media, digital platforms and information sources shaping communication and worldviews. Person in environment, PE, fit. The person in environment, PE, fit concept refers to how well an individual aligns with their social, organizational, and work environments. A good fit enhances well-being, productivity, and overall satisfaction, while a poor fit may cause stress, dissatisfaction, and dysfunction. Models of person-environment fit. Person-person fit refers to the compatibility between individuals in personal or professional relationships. Example, friendships, mentorships, or supervisor-employee relationships where values, goals, and communication styles align. Importance, builds trust, cooperation, and emotional support in social and work environments. Person-organization fit, PO fit, examines how well an individual's values, beliefs, and personality align with an organization's culture and mission. Example, an employee who values innovation thriving in a tech startup that encourages creativity. Importance, leads to job satisfaction, loyalty, and reduced turnover. 3-person job fit, PJ fit, focuses on the match between an individual's skills, abilities, and job requirements. Example, a detail-oriented person working successfully as an accountant. Importance, ensures efficiency, job performance, and career satisfaction. 4-person group fit, PG fit, examines compatibility between an individual and their work team or social group. Example, a team player fitting well into a collaborative work culture. Importance, enhances teamwork, reduces conflicts, and improves group cohesion. Cognitive perspective on person-environment fit. From a cognitive perspective, individuals evaluate their environment based on perceptions, expectations, and experiences. This influences their ability to adapt and integrate into various social and professional settings. Self-perception, how individuals view their own abilities and values affects their perception of fit. Expectations versus reality, mismatched expectations may lead to dissatisfaction. Adaptation strategies, cognitive flexibility helps individuals adjust to new environments. Person-environment fit in social work practice. In social work, the PE fit model is crucial for assessing and addressing clients' challenges in their social environment. Client assessment, identifying personal strengths, environmental barriers, and support systems. Intervention planning, creating strategies to enhance the client's fit within their environment. Advocacy and support, helping individuals access resources to improve their well-being. Policy development, promoting social policies that foster inclusive and supportive environments.
Thank you so much for watching. Don't forget to like, share, and subscribe. See you in next video.